Good day, everyone. We are the Group 1, and today we are going to talk about the Ottawa Charter for Health Promotion in Teenage Pregnancy. So, for our issue, we have the teenage pregnancy. For the community focus, it is all about the urban poor adolescents in the Philippines, which is a group with higher vulnerability, limited access to education and health services, and escalating teen pregnancy rates recognized as a national and social emergency in 2019 by Manez and Resho 2023.
So, in building healthy public policy, it is crucial to ensure that laws and regulations promote the well being of the population, especially vulnerable groups such as women and adolescents. The Responsible Parenthood and Reproductive Health Act of 2012 is a landmark law that seeks to promote reproductive health by mandating access to services such as contraception, maternal care, and sexuality education. This will help to reduce unintended pregnancies and support better health outcomes for women and children. The Adolescent Pregnancy Prevention Bill, now approved by the House, aims to combat the rising rates of adolescent pregnancy by ensuring that young people receive comprehensive, accurate, and culturally sensitive sexuality education. This law also focuses on creating community-based that reach and engage adolescents, empowering them with knowledge about reproductive health and safe practices. Number one example of this is the family planning program in the Philippines provides free contraception and reproductive health services, improving maternal and child health. Next is to create a supportive environment. It will offer you a youth-friendly health services in urban poor area safe. So it means that we foster spaces where young people can access where young they need without fear of judgment or stigma. This includes providing youth-friendly health services which offer a safe and inclusive space for young people to seek advice, counseling, and reproductive health services. These services are essential for ensuring that young individuals or underserved communities have the support that they need to make informed decisions about their health and future. So one of the example of this is that teen health centers in urban poor areas provide confidential services, including counseling and birth control, to support young people's sexual health.
Strengthen community action. So engage local adolescents, parents, barangay officials, and health workers in co-designing interventions applying community-based participatory approaches to ensure cultural relevance. So strengthening community actions means getting teens, parents, and local leaders and health workers to work together in creating plans to prevent teen pregnancy. By involving the community in the process, the programs can fit the culture and the needs of the people. This teamwork helps make the program more accepted, effective, and long-lasting.
So next is develop the personal skills. It provides comprehensive gender-sensitive sex education that addresses power relations and reproductive autonomy, such as education has shown significantly greater efficacy in reducing adolescent pregnancy. So this gender-sensitive sex education addresses equality, respect, and power relation while promoting the reproductive autonomy. So by providing the accurate age appropriate information on sexual health, contraception, and consent so that adolescents are empowered to prevent the unintended pregnancies. So next is to incorporate innovative methods like game-based learning, example, the Filipino app Alam Na 2.0. So this Filipino app significantly improve adolescents' knowledge and attitudes towards the sexual and reproductive health by encouraging responsible behavior and reducing early pregnancy risk.
So the next one is reorient health services. So shift from reactive to preventive services, school-based programs, mobile clinics, per-education, are integrated with primary healthcare to support adolescents proactively. So basically, it means changing the way health services work so they focus on preventing health problems before they start instead of only treating them after they happen. So in Philippine context, for example, school-based programs where nurses or health workers regularly visit schools to give free counseling, health checkups, and reproductive health information to students. So this helps prevent issues like early pregnancy by giving teens the right knowledge and early support on. So next example is mobile health clinics that travel to far-flung areas like Mindanao to provide young people with reproductive health services, including their education, contraceptives, and medical care, especially when they are no nearby hospital or clinics. So it's all about bringing the services closer to where teens are, so the help reaches them before problem gets worsened.
So for this slide, we'll be comparing two widely recognized frameworks in health promotion, the Ottawa Charter for Health Promotion and Pender's Health Promotion Model. Let's begin with the Ottawa Charter. This framework was developed in 1986 by the World Health Organization and is considered a cornerstone of public health promotion. Its strength lies in its macro level and multi-sectoral approach, which means it involves different sectors such as health, education, housing, and government working together. It emphasizes policy development, creating supportive environment, strengthening community action, developing personal skills, and reorienting health services. So the main focus is on structural determinants and system level action, addressing the broader social, economic, and environmental conditions that influence health outcomes.
Now, on the other hand, Pender's health promotion model, developed by Nola Pender, focuses on the individual level, specifically on the individual factors that shape health behaviors. The model's core constructs include perceived benefits and barriers, social support, self-efficacy, and interpersonal situational influences. In simple terms, it examines how persons' belief um, motivations, and surrounding relationship influence their actions toward health. Evidence from studies on pregnant women shows that social support and perceived benefits are positively associated with healthy behaviors, while perceived barriers have a negative impact. This highlights the model's strength in explaining why individuals choose to act or not to act based on cognitive and social processes.
In this part of our slide, we will summarize the comparison between the Ottawa Charter for Health Promotion and Pender's Health Promotion Model based on three main features. Let's start with the level of focus. The Ottawa Charter works at the macro level, concentrating on policy, the environment, and community systems. In contrast, Pender's HPM focuses at the individual level, specifically on individual cognitions and social dynamics that influence personal health behaviors.
Moving to intervention targets, the Ottawa Charter directs its efforts to structural changes, community empowerment, and service improvements. This means it addresses the larger system and resources that shape health opportunities. On the other hand, Pender's health promotion model targets beliefs, motivation, and social support and also perceived barriers, aiming to understand and influence the personal and social factors behind the individual choices. And then lastly, when we talk about youth in campaign design, the Ottawa Charter role is to set the enabling context. It ensures that there are supportive policies in empowering environment and active community engagement that make healthy choices possible. While on the Pender's health promotion model is more about shaping the approach. It helps in crafting effective messaging, persuasive appeals, and peer support structures that motivates individual to take action.
Now let us talk about the community-based health education campaign design. So for our campaign name, we have the Buhay Kabataan, Planado at Protektado. For the Ottawa Charter action areas applied, firstly is we have the health public policy. As what we have mentioned earlier, we need to advocate for full implementation of the Responsible Parenthood and Reproductive Health, also known as the RH law, in urban poor areas. This is for us to ensure that the adolescents have access to contraception, health education, and reproductive health services. And as well as we need to support the passage and local funding of the adolescent pregnancy prevention bill to strengthen comprehensive sexuality education and community-based intervention. Now, for the supportive environments, we need to create adolescent-friendly spaces in barangay health centers with trained counselors to provide confidential and non-judgmental services. In doing this, we need to establish a safe space in schools, communities, wherein the teens or the adolescents can engage in open discussion and receive peer support. This is for them to avoid feeling of the fear of stigmatization towards them.
So next, we have community action. So we can form youth health council with teens, parents, and health workers to plan and create messaging materials and outreach strategies for health campaigns. In these councils, everyone will have the chance to share experiences and opinions to identify the community's real needs. We will also use the community-based participatory research approach, meaning that from creating messages to designing educational materials and outreach strategies, the community is involved in every step to ensure alignment with its needs. Through this approach, trust and support are stronger because people know they are directly involved in creating the solution. For personal skill development, so we can implement the comprehensive sexuality education curriculum, which is not only about biology and reproduction, but also about gender dynamics, equality, respect, and empowerment. The goal is to equip young people with the right knowledge and skills to make informed decisions about their health and relationships. We can also use interactive and gamified tools such as Alamna 2.0 to make the learning process more engaging and enjoyable. Alamna 2.0 is a mobile game-based learning app in the Philippines that teaches adolescents about health in a fun, interactive way. Study shows that it improves youth knowledge and attitudes on health topics. Through games and digital activities, lessons become easier to absorb and the youth become more engaged. Next, we have reorient health services. We should improve health services to be more youth friendly. We can integrate youth counseling, contraception referrals, and follow-up support into barangay health centers and school clinics. The goal is to make these spaces safe and welcoming for young people so they feel comfortable seeking for information or asking for help. Through this approach, we address not only the physical health but also the mental and emotional well-being of the youth.
Now we have the evidence-based prevention strategies. Firstly is we have the CSE or also known as the Comprehensive Sexuality Education and Contraception Access. Global evidence shows that combining accurate, age-appropriate sexual education with access to contraception significantly lowers the teenage pregnancy rates and improve adolescents' sexual and reproductive health outcomes by increasing knowledge, safe practices, and service use. So with this, it equips the adolescents with accurate knowledge, practical skills, and the means to prevent unplanned pregnancy while also reducing the misinformation and risky behavior. Second is we have the game-based learning. An example of this is the Alamna 2.0. In the Philippines, the Alamna 2.0 is a mobile app that has been proven to boost adolescents' knowledge and positive attitudes towards sexual health through interactive, gamified learning and making education more engaging and relatable. So for this, It captures the youth interest, making the education more engaging and easier to remember, which increases the likelihood of a behavior change.
Lastly, we have the community-based participatory research methodology ensures cultural fit and community buy-in. So this ensures that programs are culturally appropriate and aligned with the lifestyle, values, and needs of the community. Because the community is actively involved in planning and implementation, there is successful. This also fosters a sense of ownership among the people, making them more committed to supporting and sustaining the program.
So I will now begin the presentation on campaign outputs of our health promotion campaign. So these outputs will help reduce teenage pregnancy among urban poor adolescents. Our campaign is guided by three main pillars, which is empowerment, education, and access. Empowerment focuses on giving adolescents the confidence and decision-making power to take control of their sexual and reproductive health. Education ensures that they have accurate, age appropriate, and culturally relevant information, while access means that the services they need are within their reach and are delivered in a safe, non judgmental environment. From these pillars, we identified five key components of our outputs. First, we will hold policy advocacy events and prepare local ordinance drafts to strengthen the responsible parenthood and reproductive health law and to support the adolescent pregnancy prevention bill at the community level. This will involve close coordination with barangay leaders and local policymakers. Second, we will create youth councils made up of adolescent representatives, parents and barangay officials, and health workers. These councils will co-decide intervention strategies to make sure our approaches reflect the actual needs and cultural context of the youth in our community. Third, we will implement school-based comprehensive sexuality education modules that tackle gender dynamics, reproductive rights, and healthy relationships. To make these lessons more engaging, we will also use gamified learning tools like the Alumna 2.0 mobile application, which has been proven effective in improving adolescent knowledge and attitudes toward reproductive health.
Continuing with the campaign outputs, our fourth component is the creation of peer support groups and mentorship program. These groups will be safe spaces where adolescents can openly share their experiences, ask questions, and learn from trained youth mentors who can offer guidance, encouragement, and accurate information. Fifth, we will enhance the youth-friendly health services at the barangay level. This includes setting up adolescent-friendly corners and health center staff with trained counselors where young people can access confidential consultations, contraceptive referrals, and consistent follow-up care. To ensure these outputs are not just implemented but also effective, our campaign will follow a monitoring and evaluation framework. For process indicators, we will track the number of youth councils formed, the number of educational sessions conducted, and the total number of adolescents reached. For impact indicators, we will assess improvements in knowledge, changes in attitudes towards sexual and reproductive health, and increases the contraceptive among adolescents. Finally, for our outcome indicator, we will monitor changes in the teenage pregnancy rate in the community over time, with the goal of seeing a measurable decrease. These campaign outputs are designed to be practical, measurable, and sustainable. They will serve as a proof of progress, guiding our future interventions and ensuring that our work continues to meet the needs of our community adolescents.
To summarize, Buhay Kabataan, Planado at Protektado empowers Filipino youth to take charge of their future, armed with knowledge, backed by their community, and protected by supportive policies. Through proven strategies like CSE, contraception access, and interactive learning, this campaign turns teenage pregnancy prevention from a mere lesson into a powerful movement, shaping stronger, healthier, and brighter futures for every young Filipino. And that would be all. Thank you for listening.